All right, I don't normally do political, but with all that's going on, I just kind of had to chime in on this one. And what better medium, right? So here's how the story goes. I've got good health insurance, and I pay north of 125 a month. You know, it might be more. They keep changing. My premiums go up pretty regularly. Um, but I've also got a deductible of $400. Thank you, United Healthcare. And it didn't used to be that way. 3 years ago, I didn't have a deductible, but that's gone up, and my premiums have gone up. So I've got $30 for a regular visit, and I've got $60 for a specialist visit, and they don't cover a dime until I reach $400. And since I never, nothing's ever listed, you don't know if you're looking at a $200 bill when you leave the dock or a $2,000 bill when you leave the dock. It's really hard to tell. Nothing's really listed. I'm a little confused on why that's true. But, anyways, so I was thinking about universal health care, and I'm like, this whole idea of choice is an illusion, right? Because I've had three different insurance groups because my employer has decided that they want to go with someone else because it was a better deal. And so all those doctors go away and they go to a different network. And a whole bunch of new doctors go in. So I thought that was kind of caca big time. And then I went ahead and I looked on data source for United. It's the IMF World Economics Outlook. And just did a little bit of short term research. And because I'm a researcher, it's part of what I do. And Philippines has um, full pay, or has full coverage, and they have a universal health system. Thailand has universal health system. Philippines sits at 40th on a ranking of wealth GDP, and we're at number one. We're above China for national GDP, and at least for the moment, and it's insane. We could almost I live in modest livings, but I am a prince compared to where what some of these people live in, and yet if I get hurt, I'm boned, and if they get hurt, they can just go to the doctor. If they just feel like I got the sniffles, you know that's wrong. It's just wrong. And then, but I was thinking, well, okay, would universal health care be better? And I mean, yeah, it looks good on paper. I'll be honest, I haven't heard any bad complaints from any of my friends who live in other countries, but I was like, well, what does it have the flexibility? And now I can't say names because of an NDA, but I swim in entrepreneurial circles now and then. I wish I was an entrepreneur, in which case I probably have a better webcam and the whole setup on the back and everything, but I don't. Um, it's Ireland is the area, and they're working on this project where it's going to help something with um, retirement homes, and it's actually it's not just a gimmick; it's actually a real need, and they're going to solve it. And what occurred to me, as my friend had told me more than once that he's got full coverage and tried to explain the system to me, and I'm like, I get it. You're covered, okay. Americans can go suck dirt, right? Okay, that's how we treat ourselves. That's how you treat yourselves. Got it. If I was in Ireland, I'd be covered. If I'm here, crawl to the hospital on your lips unless you want to pay. So, anyways, but back to the thing. He's working on this thing for his retirement communities, and like it then also occurred to me, like retirement communities are covered by healthcare. I mean, that's kind of a good thing because they're extremely expensive here, and it's if you're lucky enough to be able to have your loved ones cared for, that's great. But he was able to work. He's working on an entrepreneurial idea that's going to allow him to interject a better idea into a system that is government covered. And it occurred to me that we could probably have that here. We could have a system where we are covered, but there's still room for entrepreneurs or inventors to bring more value to the system for everyone. And now, upon that, I'm kind of more puzzled on why we don't have that. Everyone who has ever said, "Nah, it's a bad idea," I think either A, they have a lot of money and they don't pay their fair share anyways, or B, they're not, they haven't done the homework. You know, when I was younger and had a lot less money than I have now, which is not a lot, but I got a hernia, and I actually had to. My intestines were kind of leaking down to my ball sack, and I was young in my in my 20s, and my friends would be like, hey, you're looking pale, and then I have to find a quiet place and push my intestines back up into my body, and I had to kind of fake it until I could get some insurance to go through, and then I finally got my fix. And it's funny now. It's a funny story to tell people, but when you look at the case of how things have run, and our fellow Americans that are they're hurting, maybe it's not so funny. Maybe a healthier society overall. The tide rises all boats. That kind of thing. I mean, I think about I'd like someone to be able to go in and get flu shot or go in and get antibiotics they need them and not be sick when they're working in the restaurant where I eat. That would be nice. Or have weird rash and be touching my food. Or not able to see correctly and they're adjusting my brakes. I mean, when you think about it, yes, it's self-motivated, but it really is something to be considering. So I think, in a nation where we rank pretty high up there, it's worth it for us to try something better. And I think that is a good idea. I mean, it doesn't matter what side of the spectrum you fall on, whether you're Republican or Democrat or Independent or Martian, what have you. If you're an American, you have to think about the bigger picture of things. And trust me, I'm not a big fan of political season, and I'm not a fan of how things are right now. And I just can't believe that I have good insurance, but it's going to cost me $400 plus copays before my insurance company can even help me. And this is considered a good thing. That's my choice, I guess. Anyone who is on the TV shouting against this, they're probably making seven figures. Easy. And that's something to think about. I believe in, and grant, a lot of people are going to be like, that's a leftist socialist viewpoint. I think in a society where our military protects your wealth, our construction crews fix your streets, and our engineers build your buildings, and you get a lot of benefit out of that, you need to pay your fair share. And I would be interested in paying my fair share, as I always have. It's just the way I think. I think that being fair is not wrong. As is, I suppose there's a lot of argument against that. Anyways, I was thinking about my ear problem and how I'm not going to the doctor and listening to my other ear, listening to all this, and I thought I'd give my 2 cents. Not really a thumbs up or a thumbs down thing, it's just what I was thinking.